Okay, we're on chapter 12. We're going to be talking about baselines. We've already talked about baselines quite a bit, but this chapter focuses on baselines, so we're going to cover it in more depth. Again, baselines is the period of time during which no formal intervention is implemented. Usually first implemented prior to the intervention, and except in crisis situations, and I'll go over another situation where it's not implemented prior to the intervention later in the lecture. But and if you think about it, and I mentioned this in the previous lecture, it's you know, in classic research it's analogous to a control group. You know, in a control group, the control group doesn't get an intervention, whereas a treatment group gets the treatment. So you can think of it, if it's helpful, as analogous to a control group. And just as you compare a baseline and an intervention phase in a single system design, in a classic research design, you compare a control group to your treatment group or your intervention group. The purposes of baseline is to provide a basis of comparison to determine change. It's very important to know where you're starting from. You do this during your assessment period to determine the extent of the problem and hopefully the cause of the problem. There are different types of baselines. There are concurrent or prospective baselines. Those are ones that are happening in the present time. And then there are reconstructed or retrospective baselines. And I mentioned that sometimes these are based on records, but they can also be created from memory. If you have a client coming in, for example, a client coming in with panic attacks, and you ask them, you know, how many panic attacks have you had, you know, in the past week, they may be able to tell you, you know. So it's best for specific concrete events, and it should be recent if based on memory. Certainly they probably couldn't give you a month's worth of data. Probably it's good for a week, 2 weeks at the best. And retrospective or reconstructed baselines can be long if they're based on archival data. The example I gave you, the number of missed appointments, if agencies keep data on that, certainly that you can create a long baseline based on that archival data. And there's no reason why you can't combine retrospective and prospective. You should combine retrospective and prospective data as long as they're accurate. In terms of length of baselines, there are no clear scientific based answers here. There's only guidelines long enough for assessment and evaluation. You want to continue the baseline until it's stable. And we looked at some baselines that weren't stable. If you don't have a stable baseline, it's going to be really hard to compare anything to it. And in terms of time guidelines, again, there's no set time guidelines, but what's you know, if you're using a weekly measurement, usually you can, if you're creative, you can get in three weekly points. You know, if you do initial contact, when you initially contact the client, and then when you do your intake, you can get some more data, and then at the beginning of your first intervention appointment, you can get another baseline point. So, and then in terms of daily, if you're taking daily measures, you should be able to get in about you know, at least 7 between the first, you know, your assessment and your first appointment, you know, your first intervention appointment. Stability guidelines. Again, baselines ideally should be continued until it's stable. There shouldn't be any wild fluctuations in data, and it allows you to predict the target given no intervention. So it's really important to know where you're starting from, so that you can project out, okay, if we hadn't done any intervention, where would this person be? And there's different types of baselines we'll talk about, and we have a graph for each one of these: flat, stable, increasing, stable, decreasing, stable, variable, semi-stable, and unstable. Flat baseline looks like this. That's ideal. Increasing baseline, which is stable, it's just increasing. The client is getting worse in this case. Decreasing baseline, stable. Decreasing baseline, stable. Sorry about that. Here's a variable baseline that is semi-stable, and you may want to say, well, why is this semi-stable? It's going up and down, but it's going up and down every other week. There's a pattern there that you might want to investigate. You know, maybe the person gets their children, you know, they're divorced and they get their children every other weekend or something. You know, maybe there's something that happens every other week, but it's semi-stable because there is a pattern there. And this is just an unstable baseline. There's no pattern. It's all over the place. It's really no use. So either there's something wrong with your measurement, or your client is just that unstable. So at this point, you need to make a judgment call, and you'll have, if you use multiple measures, if all your baselines are unstable, that should tell you something different than if only one of your baselines are unstable. Maybe that's just a bad measure. If all your baselines are unstable, maybe you should, you know, talk to your client about the data and try to ferret out, you know, why their mood fluctuates so much. You know, maybe in this case we're talking about days. You know, I don't know if it may be a function of their diagnosis, if they're bipolar. I don't know if they fluctuate in and out of moods that quickly, but in any event, things to consider when trying to establish a stable baseline. Sometimes there's not enough time to establish a baseline. Sometimes clinical necessity just forces you to, you know, go ahead and do an intervention if you don't have time to establish a stable baseline. You'd also want to consider whether your measure is reactive. You did your little behavioral observation project. Some of you, quite a few of you, noted that just recording the data was a factor in the target that you recorded. You want to consider the reliability and the validity of the measure, because if you're using standardized scales. And it's helpful to assess sources of variations in the baselines with your clients. I mentioned that a couple different times. Multiple measures may be helpful. I also mentioned that, if you have an unstable, if you just have one unstable baseline and your other baselines are stable, then maybe that measure isn't any good. Time guidelines, minimum of 3 observations. This is probably the maximum you're going to get if you're doing a weekly standardized scale or any other type of weekly measure. But if you're doing daily recordings, you might be able to get 7 to 10 daily recordings in. So the more the better, because again, you want to know what's going on with the client, and the more data that you have in your baseline, you'll have a better comparison. When are baselines unnecessary? We've already talked about they're unnecessary in some crisis situations, and they're unnecessary when there's no history of the desired behavior. And for example, if you have a client if you're recording the number of AA meetings they're going to, they've never been to any AA meetings, or you're recording the number of volunteer hours or something like that. If there's no history of the desired behavior, then there's no baseline. Frequently asked questions concerning baselines. I know all these are probably burning questions on your mind, so we're going to go over them. Baselines. Does a baseline delay intervention unnecessarily? And I would say for the most, I want you to pause, think about it, but for the most part, I don't think if you build it into your assessment that it takes that long. You have to sell it to your supervisors. You have to build it into your assessment so it doesn't take that long, because there are ethical concerns if you don't treat the client in a timely manner. Is it warranted to delay implementation of an intervention? In some situations, yes. In some situations, no. In some situations, there are ethical concerns in delaying the intervention. But if you are so unsure about a problem, you might need more time to determine what the problem is and what the cause of the problem is during your assessment period. So in that case, I don't think it would be unethical, and I think it would be warranted to delay the implementation of the intervention. What should you do if targets change during baseline? Well, this is the situation where you have an unstable baseline, and again, you may need to add other targets, other measurements. If you determine that there's a problem with your measurement, you may want to start collecting your baseline data over again, although that's probably not clinically feasible. But you may want to decide maybe your measurement isn't the best measurement, and maybe it's a function of the measure that you're what should you do if your targets change during baseline? So if your problems change during baseline, I'm sorry I read that wrong. If your problems change during baselines, then of course you're going to have to add measures during your baseline. And in that situation, you may be in a situation where it does delay implementation of a intervention, where you have to do a shorter baseline. What should you do if the target improves during the baseline? And we saw a graph where it was indicated last chapter. And I mean, if your client is improving during your baseline during the couple weeks, you may want to question whether you should intervene at all or intervene in that problem area. Maybe you're selecting the wrong problem to intervene in if the problem is improving during baseline, especially if you have multiple measures saying that. You shouldn't, if the client is improving on their own, you wouldn't want to intervene. What should you do if the client won't cooperate in collecting baseline data? And this is a common problem. People don't like to do homework. It takes some time. So I think it has to do with your relationship with your client, how you present the measurements and the measurement package, how important you tell them it is, how you're presenting it with confidence, you're using the data, all those things that we went over before, and the rapport that you have, and the feedback, and also giving feedback to your client, to show them that you're using it. And I think what's also helpful is to compare it to the medical model, just to say that, in order for me to tell that you're getting better, I need measures. Just like, doctors take your blood pressure, your pulse, and give you blood tests and take different measures. I need some measures to determine whether you're getting better or not. So that's the end of chapter 12.